And since we're talking technology, Joel, there has been such a rapid change in the new technologies like Gen AI and large language models coming our way. It has kind of changed the AI landscape that we were aware of compared to previously. Everyone has a chance to experiment with Gen AI right now. Everyone's using it in some form or the other, you like it or not. And especially, you talked about having kids. My kids are growing up with it. They're already using it to write plays and do their stuff at school. So what are some of your thoughts around AI and Gen AI and the initiatives using these sorts of technologies to accelerate the pace of innovation or for better patient care and better healthcare delivery?
Yeah, so it's obviously huge. And I won't belabor the obvious point, which is you've got to think about cybersecurity. You've got to think about privacy. You can't dump a bunch of protected health information into some Gen AI thing and risk that data becomes public and leaked out with a malformed or malicious prompt, et cetera. So that's a whole issue that we've got to come to terms with as an industry. And our vendors need to understand they're going to have to help us if we want to really lean into this stuff. So with all of that said, there's a ton that I think the industry is looking at, and we certainly are too. Ambient technology is a huge piece of this. We are piloting a number of solutions there, and it's promising, just like so many new technologies are. But I think the trick is every doctor going to appreciate, ambient documentation in the same way? So this is where you have a microphone in the room, typically on the doctor's phone, that records the dialogue between the doctor and the patient. And the output of that is the documentation of the visit, which can take, 5-10 minutes per patient if I'm doing it sitting at a keyboard, and all of maybe 60 seconds to review if I'm just looking over what the AI did. So that's promising. But again, you've got maybe a third to half of providers that love it. You've got a chunk that say, nah. And then you've got a chunk who, what do they think? So how do we think about those different providers? How do they adopt it? How can we coach people to adopt things? It's like autopilots in airplanes. There's going to be people who say, back in my day, we didn't have that. But it's a tool for safe and efficient flight. And how do we get people there? So that's one example. I think the other big thing I would point to is idea generation. So, whether we're thinking about an individual patient or thinking about hospital-wide strategies like patient flow, how can we use AI to come up with, here's a problem, here's a patient, what are we not thinking about in that area? That's what AI is so good at. It's thinking about things differently. Those are some of the thoughts that we're thinking about.